We have a quorum, I believe, so thank you very much for being here. We're going to ask that our meeting be called to order and ask for the roll call right now.
Sure thing. Ms. McLaughlin.
Here.
Mr. Ricard.
Present.
Mr. Beston. Ms. Chapman. Mr. Camiso.
Here.
Ms. Cunningham. Mr. Demolowitz. Mr. Moriello.
Here.
Ms. Whalen.
Here. Thank you again. Appreciate you being here. Can we get we have five items on the agenda, including the approval of previous meeting minutes. Can we get a motion for the minutes? Motion by Camiso, second by Ricard. All those in favor?
Aye.
Aye. Thank you very much. Could you read this next item on the agenda?
Sure thing. Authorizing an agreement with New York State Industries for the Disabled regarding ancillary laundry services for eligible individuals in the expanded in-home services for the elderly program.
Okay, we have Michelle here.
Yep, good evening.
Commissioners indisposed.
Yeah, thank you. We're looking for approval to renew an agreement with New York State Industries for the Disabled to have our laundry services for the ISEP program it's an ancillary service that is approved through the ISEP program, and we're looking to have up to $100,000 set aside for paying for those laundry services. This is for people who are at home and can stay at home with a little bit of extra help. And this helps them do that. And this is a contract for, which is 60% state and 40% county, reimbursed through a grant from the Office for Aging through the department, the Albany County Department of Aging.
Is the next item connected to that as well?
Well, that is as a different ISIP service, yes.
Okay, I think 3 and 4 might be connected okay. As I was reading it, I thought there was 2 that were doing for the same services, but maybe I got them mixed up. Okay, so anybody have any questions regarding this?
Just
Mr.
one quick
Moriello?
question. This is a cost of $100,000 and to service 170 people?
No, the 170 people are enrolled in our ISIP program for any of our ISIP program services. Out of those, 55 in the last year received the
So it's
laundry service.
$100,000 for 55 clients?
Anywhere from, it goes up and down. It's been anywhere from 55 to 75 to 100 people. So it depends on the need.
Okay.
And it's an up to 100,000 depending on.
$100 a month.
So it's not 55 necessarily spending 100,000. Yeah, it doesn't work like that, and we pay per bag, so it's up to 100,000 depending on how many enrollees we have.
Any idea what the average cost is per client?
I'll have to find out what we pay per bag. I think it's like $15 a bag for a bag of laundry.
And is that done weekly?
It can be depending on the need of the person. Could be done bi-weekly or weekly, so it depends on their need.
So it's supplies and services?
They will they'll pick up the bag and they'll take them to the laundry and then they'll deliver the clean laundry back.
Yes, Ms. Whalen.
My kids did this in college, and I paid for it, so it is around it's usually by the pound, I think, right? Is that how they?
Ours is by the bag.
It is, okay.
Yeah.
Or the bags usually are around 15 to 20
Yeah.
pounds. And, it seems like it's in keeping with what those, services in college are. It's like around 2,000 a year, probably. Seems around accurate. So if there aren't any other questions, I'd like to make a motion.
Is there a second? Motion's in second, all those in favor?
Aye.
Aye. Thank you so much. Pass unanimously. Number 3.
Authorizing agreements regarding the expanded in-home services for the elderly program.
Right, we're looking for approval to enter in agreements with 12 home care service providers to service the clients that are enrolled in the ISIP program and Title 20 services for home care services to help keep people who are able to in their homes and hopefully out of nursing home care. And this is to help them with their activities of daily living and to be maintained in a safe manner at home. This is for non-Medicaid eligible folks, ISAP is. And this is up to, again, $1.09 million, again, funded in the same way through the New York State Office for Aging and county. We have a county share on this, through the Department for Aging in Albany County.
Any other questions, Mr.
Gary,
Demolowitz?
Gary's good.
Okay, Gary, you have a question?
Yes,
Yes.
I passed, I sponsored and passed a local law with this body probably a few years ago, where these agencies have to get criminal background checks for their employees. Do you know if that's being done? And it was through the sheriff's department. Is that being done?
The New York State now requires that of all home care, certified home care workers, with agencies, which these are. These are New York State certified agencies, approved agencies. And now New York State has, I don't know at that time if all the counties were doing it, but New York.
I only speak to Albany County.
Yeah, but New York State now requires it.
Oh, good.
So,
For all the people they hire.
for certified agencies, if you're a certified agency, anybody you hire to go for home care services in a home has to meet those requirements, background checks.
Oh, good. Thank you, thank you.
Anyone else? Mr. Moriello?
Yes, is this,
Where do I go?
are they servicing 170 clients here with this?
Correct.
So that's 1 million, almost 1,100,000 for 170 clients?
That's what we're currently serving. We have capacity to serve more financially. However, there's a home care aid shortage. So we have a waiting list. So if we filled the waiting list, we would probably exceed the $1 million. So we're always trying to fill the hours that we have.
So this saves us money by providing these in-home services and not sending them to nursing homes?
That's the, yes.
Still quite a bit of money, $1.1 million, okay.
Do you get to carry money over? Let's say you didn't spend all the money because you didn't have the home health aides.
Yeah, right. Thank you. There's the aging contractor.
No, yeah, we cannot carry over because it's a state, ISAP is a state funding, and it's not, you have to use it within the allotted time frame, basically. Usually it's from April 1st of one year to March 31st of next year.
So it's pay as you go, and you don't get it, you don't get a lump sum, you return it. Is it as you use it, then you get reimbursed? Is that how it works?
Well, it's basically, if you do not use it, you lose it. But I mean, and ISAP services are a little bit down right now, as you know, but we can use that money for other services because we're still under major disaster declaration, so.
Okay, because I mean, I was sort of trying to read into Mr. Moriello's questions. It seems like a lot of money in a couple of these programs for a small amount of people. So if you can use the money someplace else to serve other needs that those same people may have or others, that makes me feel better, that you're not just giving back money, not for no fault of our own, because you don't have control over home health aides being available.
Well, we have never given it back yet.
Okay. And that's good to hear. Was there a motion?
I can.
Mr. Ricard, second?
Second.
Ms. Whalen? All those in favor?
Aye.
Thank you. Next one, please.
Authorizing an agreement with the New York State Office for the Aging regarding the Medicare Improvement for Patients and Providers Act grant.
Good evening, everyone. Thank you, Chair, and to the committee. My name is Pat Dillon. I'm with the Department for Aging, and we have a couple of items that we're asking approval for tonight. The first one is, just to get started, every year we come to you and we usually apply for 14 grants to NYSOFA. And so the first one that we're asking approval for is one of those 14 grants. It's our Medicare Improvement for Patients and Providers Act, which we call MIPA. So what MIPA will do is it complements our HICAP program, which is our Health Insurance Information Counseling and Assistance Program. And even though that Medicare, even though the MIPA and the HICAP are from the federal government, they operate on two different time cycles. One is September to September. HICAP operates from April to March. Once we get the Medicare, the MIPA money, what we do is we distribute it in 3 different areas in the aging department. We'll develop a MOU with DSS, and this funding will funnel through our New York Connects department. The next, we'll keep it internally because we have a HICAP coordinator that handles difficult insurance situations, Medicare and health insurance situations for our older adults in the Albany County area. And the third, it will go to our New York Statewide Action Council. Last year, we RFP'd the HICAP grant funding, and we received a proposal from Statewide, and we awarded them the contract. And Statewide, this is their bailiwick. They've been in the business for 50 years, and they specialize in the HICAP program. So we awarded it to them, and roughly speaking, this grant is about $33,000, and MIPA is roughly $23,000. So Statewide usually handles about 1,000 beneficiaries per contract year, and they produce about 12 outreach community workshops. So we get a big bang for our buck with the healthcare, the HICAP contract.
This is throughout the county?
Yes,
I mean, so it's not just concentrated in one area?
that's right. Yep.
Anybody else have any questions?
Motion?
Motion by Carissa, second
Second?
by Wayland. All those in favor?
Aye.
Thank you very much. Our last item?
Amending resolution number 361 for 2021.
Software package to go along with our requirements. So same vendor, it's just an updated package that it's called Q-Ride Cloud. And this new software will be more streamlined, it'll be more user-friendly, and it'll be more efficient. So it'll also offer a portal. So when a client wants to get transported, they could use it by their phone or a computer, and they'll be able to track when the ride is going to be coming to them, the time, and then likewise with a round trip. So if someoe's going to get their groceries or if they're going to a doctor's office, it not only will be beneficial to the client, but also a caregiver if the person is going off to a doctor's visit, and they'll be able to locate or track them on their device. So it'll be more efficient. CDTA roughly, as far as volume is concerned, we do a lot of business with them, and they handle about 4,000 trips per month.
Right now, do clients, can they make their own appointments?
Yes.
And this is just the update, the need for
And
an
this will be
updated
updated,
system to do
right, and it'll be more user-friendly for the client.
Bill?
Thank you, Madam Chair. Just a quick, I want to follow up what you said. So this is for someone who's on their smartphone, is that what you're saying?
Yeah, they can do it on their smartphone, their computer. It's a portal that they'll be able to clip into.
Okay. How many of those this is like a Star Bus, is that what?
Well, CDTA roughly figures the first year offering this, they'll probably have about 10% of the users use this.
That's what I was going to ask you, where I was going with the question.
Yep.
I was
About
wondering
10%.
how many actually of those people actually use it?
They're guesstimating it at 10.
If they wait an hour and a half, they'll use it. Then they'll hop on.
Yeah, I know.
So what other, if it's not the Star Bus, what else do they?
Roughly, this is, okay, so it's not public transportation. What it is the 4,000 trips are, it covers wheelchair and walker. It covers motor wheelchair, the Star Bus, and also ambulant.
Okay, no other questions, motion
I have a
by
question.
Gary. Oh, you got one more question? Okay.
I do. In the second line of the paragraph, it said that they provide brokerage services for human service transportation. What's that mean, brokerage services?
Well, what they do is, CDTA isn't the only person. CDTA brokers out to about 10 subcontractors that also do transportation in Albany County for them. So they do the specialized
So
transportation.
our contract's with CDTA, but it could be 10 other people that could come to the house and pick you up?
No, what happens is it all funnels through CDTA in their phone line system, and they roughly have about 3 people that are designated to this. And then what they do is, they might subcontract for the ambulance services. So they have about 10 subcontractors that they make the appointment after the phone call is documented.
Does CDTA get a fee for that?
Yes.
So we're paying.
We pay them,
Pay twice, yeah, that's what I was gonna say.
we pay them per trip.
And we're paying the person who actually picks you up.
No, that's their subcontractor. So the fee is basically the payment, it goes directly to CDTA. They have a subcontractor that's between them and CDTA. So the contract is strictly with CDTA.
So they're assuming all liability, then CDTA, as opposed to any.
That's
One
right.
of those 10 that might be picking you up, right?
That's right.
Why don't we just broker contract with their individual agencies instead of CDTA?
Well, the thing about it is, it probably runs a little bit more efficient, and we've never had anybody come to us and want to, subcontract us with the transportation. I mean, this is a big endeavor, and we do handle a tremendous amount of people.
We got 10 companies that do it too, though.
But those 10 companies are specialized. So it's 10 companies, but one might just be for the ambulance.
Oh, no, I understand it, but it's not CDTA doing it.
It's CDTA doing it, it's just that for the specialized, there are some transportation services that are specialized that they do subcontract out to.
I understand that. I'm saying is, why don't we just do the bid and go direct to the same ambulance companies? Might be cheaper. I don't know if we ever looked at an RFP to do that. We probably should.
Kind of like we do the food. Sorry,
No,
Madam Chair.
go ahead.
You know how we do the food, like,
Yep.
like we'll say,
We are for
Different-
that annually. Yep.
yeah, we don't just give it to one food broker like Cisco or something and have them farm it out to different restaurants. Sort of, that's what you're saying, right? Like, so why is it that we are doing it one way in this instance, but not using like one general food broker when we're doing all the food
I
programs?
haven't been in the food brokerage business for 40 years. I have no problem with that.
Yeah, no, I'm not having a problem with it either, but I'm just like
I
kind
have
of
a problem
trying.
with CDTA.
Well, right, I'm just trying to like
Using
wonder
that
why they're doing
analogy.
it one way for one batch of services, like, you're questioning this brokerage subcontractor thing,
Exactly.
right? So, well, why wouldn't you then question it in every other instance? Like,
Because
what's the
the broker,
difference?
the
There,
food from
well,
Cisco.
there's distinguishing factors maybe that you might be able to address, right?
Well, like what?
I don't know, this is a bigger operation than food, transportation, more accounts, more clients,
Well, it
more
seems,
liability.
from what he explained, it sounds like CDTA is also one of the 10 that provides some of the services. I get the question, and I think that this might be something that we want to study for the next contract.
Sure.
Because it does make sense, because we do it in other places. And the example that Ms. Whalen gave is that we do it other ways, do it with other services. Why can't we do it with this one as well? So let's look into that. This contract is ready to go, and let's look into it for the next year, so that when we don't come upon it and have this same question. I mean, I think we really need to listen to the questions that legislators bring up and issues, alternatives that.
Well, they basically, the way I see it, how they do it basically, they kind of, I don't know, like keep it in-house basically and channel through them all other subcontractors. And it makes it like easier for us because we are working just with one of them basically. All accounting is done in-house by CDTA and etc. Instead of us doing like, let's say 10 different vendors and etc.
And what does that cost us? I think that's a question for me, but, I see what you're saying. Mr. Moriello has a question to say.
No, go ahead, if you want to ask a question.
Oh, no, I'm done.
All right, it would seem to be more, that CDTA has the expertise to do this. It's less complicated for the county, and if we can find someone to do the service for us, I think it makes it just easier for everyone.
Yeah, it's because they have experiences in that field basically.
Mhm.
That's why, I mean, why would we undertake something that is not like necessary, that's why, yes, they do it, yes. They do it all basically, yes.
So, and the total cost is $150,000.
Right, so, but we're not asking for additional money. What we're just doing is reallocating the funds in their contract to pay for this part of the software. So it's not in addition, it's part of what their contract is right now.
So we will be following up and, for the next,
I'll make the motion.
Ms. Moriello, second by Ricard. All those in favor?
Aye.
Thank you very much. Motion passes. Thank you, gentlemen,
Thank you.
for being here. Can I get a motion to adjourn?
Motion. Second.
Thank you, sir.
Second, thank you
Thank
very
you.
much. Have a good evening. Stay warm.
Pat, tell Deb we missed her.
Okay.